Hello, and welcome to the ASHP ACCP 2021 Oncology Pharmacy Specialty Review and Recertification course. My name is Karen Fancher, and I'm an Associate Professor of Pharmacy Practice at the Duquesne University School of Pharmacy in Pittsburgh, Pennsylvania. This presentation is about preparing for the 2021 Board Certified Oncology Pharmacist examination. First, we suggest that you review the oncology examination content outline that is available at bpsweb.org. Looking at this pie chart on the right and starting at the 12 o'clock position, you can see that 20% of the exam questions will come from Domain 1, which is pathophysiology and molecular biology of cancer. The largest percentage of questions will involve Domain 2, which is therapeutics, patient management, and education. Domain 3, which will cover clinical trials and research, and Domain 4 with practice management, and the smallest amount of questions in Domain 5 regarding public health. We advise you to use this outline to budget your study time in the individual areas that may be tested on the exam. The exam schedule is listed here. The exam is offered twice per year in the spring and fall. Applications to take the spring 2021 exam close on March 19th, and the spring exam window will be open from April 19th through June 1st of 2021. Applications for the fall 2021 exam will open on May 17th and will close on August 3rd, with the fall examination window open from September 7th through October 11th. The schedule for 2022, specifically the spring schedule, has not yet been announced. So how should you prepare for the BCOP exam? Well, our review course materials cover a lot. We want you to understand that these materials are current as of December 1st, 2020. The materials are provided in both slide and handout format. The slides focus on key points and are meant to be a bird's eye view of the information that is contained in the handouts. The handouts contain much more in-depth information and can clarify any information that you're unclear on after you've reviewed the slides. We suggest that you focus on standards and guidelines, and specifically that you understand differences between guidelines. For example, if ASCO and NCCN guidelines differ in their recommendations for a specific treatment, we expect that that difference may be testable. Conversely, any areas of controversy will most likely not show up on the exam. So if something is not a standard of care or is widely debated, it's unlikely that that particular subject would appear. We want to be clear about the deadlines for the exam questions. Although our materials are current through December 1st, 2020, the individual exams have different cutoffs for what material may appear. The spring 2021 exam cutoff for materials is January 1st of 2021, and the fall 2021 exam cutoff for new materials is July 1st, 2021. So any new guidelines, conferences, or other materials that have been released since December 1st of 2020 may not appear in our review materials, and we strongly encourage you to look those up on your own. We also feel that exam question writers love new drugs and new guidelines. So if those have been published after December 1st of 2020, or if a new drug has been approved, we strongly suggest that you spend some time reviewing those materials. For new drugs, topics such as the mechanism, administration, handling, patient counseling, and adverse effects would all be fair game. Likewise, we suggest that you consider all guidelines that are used in oncology pharmacy practice. We rely most heavily on NCCN and ASCO, but please remember to consider guidelines from MASC, the IDSA, ESMO, and other organizations. In terms of our course content, the review course is geared towards BCOP exam candidates and is not meant to be an oncology primer for new practitioners. We expect that graduates of PGY2 oncology residencies or practitioners who have worked in the area of oncology for several years are the most appropriate exam takers. For specifics, you can refer to the BPS website to determine your eligibility. Topics that we consider to be baseline knowledge for an exam candidate will not be covered in the course. However, those questions could be included on the exam. Examples of topics that we consider to be baseline include the following: the epidemiology or incidence of a given malignancy, the pathophysiology of that cancer, any signs or symptoms of the disease, how the cancer is diagnosed and what diagnostic tests would be ordered, unless the use of those diagnostic tests would influence the selection of therapy. Disease-specific risk factors are included, as well as prognosis, unless the specific prognosis dictates the choice of therapy. And finally, we do not anticipate that you will be asked to determine the stage of a patient's cancer. We expect that you will be provided the stage and asked a question about appropriate treatment for that stage, but we do not believe that determining the specific stage of cancer will be a question. We'd like to remind you that this course is designed in no particular order. The order that the programs appear on the website does not imply the weight of a topic on the exam or the likelihood of a question that will come from that specific topic. Likewise, we'd like to remind you that this course is independent of the Board of Pharmaceutical Specialties, and the faculty in the course are not involved in the writing of the specific BPS exam questions. The faculty do author the audience response questions and the questions for BCOP recertification credit, but the faculty do not have knowledge of and are not involved in the writing of the specific BPS exam questions. Our course simulates real-life situations and will heavily rely on cases in our review. We'd also like to remind you that questions may incorporate additional topics besides the treatment of cancer. Questions may include survivorship and long-term adverse effects of cancer treatment, questions about genomics, questions about specific patient or caregiver education techniques, and questions about clinical trial design. So how should you use our materials to study for the exam? We have divided the materials and will present them by individual disease states or supportive care topics. However, you can expect that the exam will interlace disease states with supportive care. So for example, the exam may ask a question about bleomycin toxicity that is under a question about testicular cancer, even though the topic of bleomycin toxicity appears under Hodgkin's disease in the review course. We strongly suggest that you listen to the audio recorded presentations and review all of the handout-only materials. We also strongly suggest that you access the web-based self-assessment test in order to test your own knowledge. When you're preparing for the exam, we suggest that you take a good look at your own strengths and weaknesses and be honest with what you find. We suggest that you critically evaluate your own knowledge, skills, training, and experience, and then identify areas that are knowledge gaps based on your own personal situation. We also suggest that you critically consider how you learn and how you retain information. So, for example, do you learn best through flashcards or case examples or repetition of material? Understanding this about yourself will help you identify the best way to study the large amount of material that is covered in the course. What are some ways to identify your own knowledge gaps? First, you should consider which patient populations you frequently work with and are currently comfortable in. For example, do you only treat adult patients, or a mixture of adults and pediatrics, or only pediatric patients? Is your practice entirely ambulatory, entirely inpatient, or a mix of both? Do you have experience in blood and marrow transplant or other specialty areas of oncology practice? And if not, you probably need to focus more of your time in that area than someone who is a BMT specialist. You should identify what you already know and what you don't. And as you read through every individual topic, critically ask yourself if you need help understanding this material, if you still have questions about this material, or if you are entirely comfortable with the material and can move on to another topic. In terms of the specific questions on the exam, the questions need to be testable on a national level. That means the questions are testing your knowledge of national standards and national or international guidelines. The question is not asking what you do at your individual practice site, what your preference would be, or what you have seen in the past. The questions are asking you about national standards and guidelines. The exam format is almost entirely case-based. Even statistics questions will be asked in a case-based format. And the majority of these cases will be application-based as opposed to rote regurgitation of knowledge. Again, we anticipate that questions will be based on the treatment of specific tumor stages, but are not likely to ask you to do the staging. So again, we anticipate that the exam will inform you that the patient has stage 3 breast cancer and ask what is the first-line treatment given this patient's characteristics and other information. If you still feel like you need more information after you've read the handouts and listened to the slides, each handout in this course includes the faculty's recommended readings for further information. And these references appear at the end of the handout. So what should you do now? We suggest that you familiarize yourself with the 2020 Candidates Guide, and the link for that resource is listed here. We suggest that you create a study schedule and establish regular study times for you to begin to tackle this large amount of information. We strongly suggest that you allow yourself plenty of time to assess your knowledge gaps and to study, and to build in some cushion there because we all know how things tend to get in the way. We'd also consider that you join a study group or find a study buddy for accountability. Even if it means you prefer studying alone, it may be helpful to check in, have someone keep you accountable, and keep you on track so that you're prepared for the examination when you have scheduled it. In terms of the actual exam day, we strongly suggest that you answer all questions and leave no questions unanswered. If you're uncertain of the true answer, we suggest that you make your best educated guess. If it appears to you that more than one answer to a test question seems correct, you need to choose the answer that is the most correct or the most appropriate. You will need to consider context and nuances within each individual question to determine which answer is the most correct for that specific question or situation. And finally, do not second guess yourself. Your first instinct is most likely the correct one. So consider what you initially thought before you choose your final answer. This concludes our presentation on study tips. Thank you for participating. On behalf of both the faculty and the staff involved in the review course, we wish you the best of luck, and we look forward to seeing you at a future recertification course. Good luck.